So I hear something extraordinary occurred on January 18th. Tell me about it.
So we were driving home from work, and it was during the middle of all of the rainstorms that we've been having, and so it was a really rainy night, it was really dark, and we were on 280 heading north, and there weren't very many cars on the road, and we noticed the car in front of us cutting from the far left lane over to the right lane, and we thought that they were just trying to make their exit, and so at first we thought that they were doing something crazy because it was so rainy, and all of a sudden their car hit the curb at the side of 280, and it flipped and went off the road, and we realized that they had actually hydroplaned and weren't in control of their car.
And now who was in the car? And you were carpooling back to San Francisco from Lucile, Packard?
Right, yeah, we were carpooling back. It was, I was driving, and Jackie Giannelli was with us from the CVICU, and Ben and Amy McDuffie was there as well.
So Ben understands something extraordinary occurred you had to do to the car.
Yeah, well, normally my daily routine of living doesn't involve kicking in windshields, but on that day I learned how to. I realized that they were very difficult to kick in. Took a lot of energy. Basically, the way that the car was positioned, it was the doors were all crushed closed, and it looked like to me there was only one way to get them out, and that was through the windshield. So we just kind of went at it with my foot and shoulder, and eventually we were able to remove all the glass, and there was a child in the car, and so I think the child was about 2 years old. So we got the child out first, and then just ascertained that everybody else was okay. It was great. We actually had a really good assembly line going. I was pulling people out of the car, and then I was passing them along the assembly line, and all the other nurses that I'm lucky enough to carpool with, as well as another nurse who had stopped, who also works here at Packard. We all kind of looked after them in varying roles. So it was great. We kind of triaged the situation. All of us took different roles, and I think we were all really proud of what we did. It was exciting.
Now what about emergency personnel arriving on the scene? How did that occur?
So after Jackie was immediately calling 911 as all the rest of us were springing into action, and they were there. It was kind of interesting, actually. The police officer that said that was the third accident that had happened on that stretch of highway, so they were kind of aware that something may happen, and so they arrived probably, I don't know, it seemed like eternity, but I'm sure that it was like less than 5 minutes. But by the time that they arrived, we had kind of triaged the situation enough that we ascertained that everybody was stable. They helped me get the last passenger out of the car, and they were phenomenal. They took over, and we kind of assisted them. Just the child needed somebody to sit with her because obviously they were busy strapping everybody down to boards and putting Philly collars on, and I think that was pretty frightening for the child and pretty frightening for the rest of the people too. Like some of them, as Anne mentioned, were like 16 years old. So
how many total people were in the car?
There were 4 people and a child. Sorry, 5 people.
Okay. and what about, was it raining?
Yeah, it was raining very hard. As the last couple of days you've probably seen, it's been kind of incredible, the rain.
So they were sent to a Bay Area hospital.
That's correct.
And you assisted with making sure that they were sent to the appropriate hospitals.
Yeah.
Okay, good.
And I was able to talk to one of the girls' parents and tell them where we were and what had happened. So her parents actually arrived on scene just before she was taken to the hospital.
What were the names of all the nurses involved in this rescue effort?
Well, there was Ann Mace, Jackie Giannelli, Amy McDuffie, Colleen from Labor and Delivery here at Packard as well, and then myself, Benjamin Terry.
And you hope you don't have to kick in any windshields again anytime soon. But
Yes.
It sounds like you really helped get this family care in an extraordinary situation.
Well, I think that that's something that nurses do. We perhaps know more than anybody else, but I was very grateful that I have the skills at that point to help triage the situation, all of us, and that we were able to spring into action and do something which almost comes second nature at times.